Hey, Dr. Rodney White here with Sarpy Chiropractic. Today we want to discuss when and when not should you get an X-ray if you're having back or neck pain. We're often asked this question because especially people who have been to a chiropractor before, chiropractors often fall into one of two camps. Either A, we blanket X-ray everyone, and we'll go into the reasons why that happens, or B, we only X-ray if we think it's needed. And a lot of people come in with different original opinions on what they need as the patient. So the gold standard 30, 40 years ago with anything, chiropractic, physical therapy, doctors, anything, if you went in with back pain, the gold standard was we should do an X-ray. But what the research over time has shown us is that X-rays aren't always necessarily, and MRIs included, aren't always necessarily going to show you the things that they need to show you. Because when it comes down to back pain especially, less than 5, getting even closer to 2% in some research, less than 2% of problems are actually what we'd call a red flag. Now, what red flags might cause back pain? An infection in the bones, cancer that's spread to the bones, a fracture, those kinds of things. And the beautiful part with those is that 95% of those things should be picked up in the original history. You as the patient might say something that triggers us as the clinician to say, you know, that doesn't sound like a normal mechanical issue, this needs further investigation. And those absolutely should be sent for an X-ray before, not only before any treatment is done, but to make sure that you're not dealing with something more life-threatening than normal back pain. Our opinion, at least the way we practice, we don't blanket X-ray everyone. We send you for an X-ray because we don't do X-rays in-house. We send you for an X-ray if we feel like you have anything that's out of the normal or potentially red flag, or if you're not improving in the time frame we expect. See, when you go to see a chiropractor, you want to make sure that they're setting short-term goals. It doesn't mean everyone's going to walk out of our doors completely healed in 2 weeks. But if you're going for 6 weeks and not having any change, something needs to be done about that. And quite often, we will send for an X-ray there just to dot the I's and cross the T's to make sure we're not missing anything. And virtually everything that's going to be back pain isn't going to be life or death difference between 0 and 3 weeks, if that makes sense. So if you've been to a chiropractor and they're saying you have to get X-rays and you're not sure you want that, by all means go and seek a second opinion. But if they're telling you that, or your doctor or anyone is telling you that they're concerned about something and it should have them done, then it doesn't hurt to get that peace of mind either. So if you ever got a question about that and you want a second opinion, don't hesitate to reach out and contact us. And as always, if you find this content useful, give it the thumbs up, share it, and everyone have a great day.